on UFM. You and I with Yasser العلياني. You and I.
What is up, ladies and gentlemen? Hello and welcome again to your favorite show, You and I, presented by your beloved host, Yasser العلياني. Tell me, guys, how was your weekend? How did it start? And how was your day yesterday? Did you guys watch the movies I told you about or not? Because I told you guys, tweet me if you liked it or not. And did you watch it or no? That's the question. Let me know, guys, if you did. And as you guys got used to, every Friday we have a special guest. And today is not any difference. We also have a special guest today. But before we start, let me just remind you guys, if you have any questions, you can call us on our direct number 0811 110999. But before we start, guys, I want to say something. Someone asked me this question on Twitter, and he was like, what is the difference between hearing and listening? This is really important, guys. There's a small difference between hearing and listening. I'm going to just say it fast just to answer the question here. The difference between hearing and listening is that listening is when you are focusing to the thing that you are hearing. Because hearing and listening, they're both the same. But if you're not focused on what you are hearing, that is called hearing. But if you are focusing on it, that is listening. So, for example, if I'm talking to someone, I'm listening to him. But if there was a sound came during this conversation, that's the sound that I heard because I don't know exactly what that sound is. So this is the difference between hearing and listening. Okay, guys, time to introduce our guest here, ladies and gentlemen. I am so excited for her, and I hope you guys are as well. We have Dr. Fatima Al-Mutawwa, lecturer and sorry about that, lecturer in pediatric dentistry. Pediatric dentistry in Riyadh. Welcome, Dr. Fatima.
Hello, thank you. Thank you for having me.
You are very welcome. How are you doing?
I'm doing good, fine, alhamdulillah. How about you?
I'm actually great. How are you doctors doing, during this pandemic right now?
Okay. Things are slightly different, a little more intense, but at the same time, we have to do what we have to do. And things are running smoothly. But again, we're focusing mostly on the hygiene and infection control in order to get our job done without harming anyone.
Okay, well, thank you very much for your service, as they say. Fatma, first and foremost, why children? And is there any difference between them and adults? Like, can I just go to any doctor if he's a children doctor and that would work out?
Okay, firstly, we need to know that there are a lot of specialties under dentistry. Because when you go to a dentist, you go to a general dentist, and there are like a lot of specialties. Like when you want to get your teeth fixed as in braces, you go to a braces doctor. When you want to do your root canal, you go to a root canal doctor. When you have a child, you will take your child to a pediatric dentist.
Okay.
That's what a lot of people were missing, that they don't know that there are a lot of specialties under the main specialty dentistry. Why children? They're so much fun, to be honest.
Okay.
Yet they're a little scary, but at the same time, they're unusual. There's no routine in the clinic, and it's challenging. Very.
Yeah. They're hard to handle. I'm sure.
Yeah.
They really
Mostly, the actual work, like all dentists can actually can work on kids' teeth because there's no difference. But the treatment planning, like you have to plan for 10, 20 years from now because they're going to lose their teeth. So the way we plan things are a little different. And at the same time, how are you going to convince a 4 years old to sit on the chair and open his mouth, and will let a total stranger to just check his teeth and fix them? So it's mostly psychology more than the actual work.
True.
Yeah.
And actually that situation will decide if he's gonna like the doctors or the dentist during the rest of his life or no.
The trauma will last forever. So you need to be super careful to whom you're going to take your child, because at this first visit is going to decide whether he's going to the dentist for the rest of his life or not. So it is really important.
But it's hard for parents, because how can, like, I don't think there's any specific way that they can know unless they ask someone that this doctor is actually good with kids or not.
Yes, definitely. But again, taking a child to a dentist is something you have to plan ahead. You have to prepare your child that we're going to this certain place. We're going to see a dentist. The dentist does this and this. You have to prepare. We have videos. We have YouTube. You have to prepare your child that we're going, what are we expecting when we go? And the same thing, me as a dentist, when I see a child for the first time, I don't go ahead and work unless it's an emergency. Usually first visits are for talking, getting to know the child, let him see everything, tell him what I'm going to do. There's a way of behavior management that we do called tell, show, do. We tell the child what we're going to do, show them the instruments we're going to use, and then do it.
Ah, okay.
Yeah, there are like a lot of ways we use to manage the child.
Okay, great. We're going to talk more about this, but guys, we need to take our first break of this show here, and we'll be back after it with more Dr. Fatima.
Thank you.
You and I on UFM. You and I. You and I. UFM.
Hello guys, and welcome again to your favorite show, You and I, presented by your beloved host, Yasser Al-Aliyani. Let me just remind you guys, if you have any question, you are most welcome to call us on our direct number 0811110999, or send us your name and your phone number using Zain 734444, Mobile 634444, STC 834333. Now let's go back to Dr. Fatma. Before the break, you said that you show them the tools, but I had a question. What if they didn't like the tools that you showed them? Because we all know that those tools are a bit scary for grown-ups as well. So what about the kids?
So let's go back like 20 years ago when you, like, let's say when you go to a dentist and they never show you the tools, and then you, surprisingly, you find the tool inside your mouth and then it hurts and then you just hate it. That's why you have this idea that you hate the tools. But the tool is actually just like a toothpick. That I'm going to use it to point at something or maybe just scratch something that's not going to hurt at all. So me introducing it to the child without him having a bad experience before will be like really easy, because it is what it is. The tool is a tool. If you explain it and show it to the child the right way, but if you sugarcoat it and then all of a sudden you do something other than what you said, he's going to hate you and hate the tool you use. I can hold that toothpick and then I'll tell them I'm going to just hurt you with this one, he's going to hate it. But if I use it gently, he's going to be fine. So just be blunt and be honest with them. I always say that child doesn't know gray. They either black or white. Either you're saying the truth or you're lying. So the start where you tell the child what you're going to do, just be honest. Tell them the truth. And if they're going to feel discomfort, just tell them you're going to feel discomfort. Try to avoid dramatizing things. Don't tell them pain. Just tell them discomfort. Because it is actually discomfort, not pain, unless there is something really painful, which they came with from home, not us. We did not cause the pain. So yeah, we're innocent here.
Okay. Usually in hospitals, we see like these kids section. It's all colorful, and they have all these kind of posters, animals, blah blah
Distractions.
blah. Yeah, distractions, because we know that kids and children they like these type of colors.
Yeah.
How about the tools? Like, are there, let's say for example, a SpongeBob tool? Let's say colorful tools.
So the colorful things, usually we put like decorations, chair, but instruments, yes, we do have, but actually the child won't see the tools while I'm using it. So I'll be using the tools. Tools are tools, you know, but we can use like colorful mirror or gown I wear, a mask, the chair itself. But the actual tools, yes, we have everything. It's just like having designs, clothes and stuff like that. But distracting the child, I mean, I can treat a child in a white clinic with no decorations and he will still be fine. It's just how you introduce things. If you sugarcoat it, it's fine, but don't over sugarcoat, because you're going to just dim the light and it's going to mislead. So yeah.
And it's important because for me, I think when I was about, let's say, 7 years old,
We all had that bad experience.
Yeah, no, actually it wasn't that bad for me, because the doctor I was going to actually made me literally love dentists for the rest of my life. When I was about 7 years old, I fell and I lost a tooth, unfortunately.
Yeah, that's Pediatric Dentistry 101.
Yes, true. And he told me that we can't plant this tooth again until I'm like about 21 or probably 22, because I was too young at that age. But I kept going there for almost about 6 to 7 months, if I recall right, for about 6 to 7 months. And like each time I go there, he like made me love the place even more by the way he was treating me, he was giving me candies, he was giving me toys, like these small things. And to be honest, until this day, I love when I go to dentists. I mean, I don't mind going to dentists, and I respect all of you guys. So yeah, it's important how you treat kids.
That's called behavior management. That when you find when you find the child does, like when the child does something really good, you just appraise it and you tell them that's really good, and you give gift. That's called like reinforcing the good behavior. That you give gifts, but again, you can tell the child that when we're going to finish the whole visits, everything, I'm going to take you to this place, or I'm going to give you this gift. If the child did not listen, do not give the gift. Do not give the gift. So yes, that's called behavior management. That's mostly what makes us different, pediatric dentistry, because in pediatric dentistry, we learn how to read children before we start even talking to them. The way they get in to the office, we just take a look at them, the way they walk in, when we ask them about their names. I'm not expecting a child to answer from the first minute. So I should not just ask directly. I introduce myself. I talk and talk and talk, and then they participate. It's just like how you, I'm not going to say manipulate, but how you make them talk without asking them direct questions. It's all behavior management.
Interesting.
Yes.
Interesting. I mean, I love kids, but I have like a certain limit for loving kids.
If you love kids, you won't be able to treat them in certain places where they're going crazy, let's say. Because yes, sometimes we get punches, sometimes we get kicked. It's fine. It's part of our job. Because you're treating, like, let's say 100 child, and then one of them or two are going to be like react crazy.
That's rough.
So yeah, you have to just take it all or leave it. If you love them so much, you won't be able to control, because sometimes they're too cute to be controlled. Yeah, they have those like puppy eyes and like little ones.
That's things you can't deal with.
I mean, yeah.
Okay, tell me, if you can recall a story right now. I want you to tell us a story that happened. Like, what is let's say the roughest kid that you had to handle, and he was so tough to deal with?
It was She was a she.
Okay.
She was 2 years old. I was in an outreach where we went to underserved communities where we had to examine children. She was 2 years old, and her mom was carrying. She was a little chubby one. Apparently, she just had a heavy meal.
Okay.
Her mom brought her to me. She was on my lab. We were in a school. Okay. And I started examining her. And I don't know how I just lost control over my fingers, and I forgot one of my fingers like between her teeth, because usually we know how to control our hands.
Okay.
So my finger was literally between her teeth, and she was uncomfortable. She bit me.
Oh.
She did not open. Literally, she locked her jaws. And she was so tiny, I couldn't force her to open. So I just kept on like asking mom for help, and mom didn't know what to do. And then she took the baby, and the baby was still biting my finger. And then my finger was bleeding. I had to take antibiotic for like a whole week for that because
Wow.
when a human being bites you, it's like really dangerous. So yeah, I almost lost a finger.
You know, the problem is there's nothing you can do about it.
Exactly.
Nothing
That's
you
why
can do
I say
about
they're
it.
too cute.
Oh
Too
my
cute.
God. Yeah, that is too cute. True, that is too cute to handle. Okay, you also do special needs,
Yes.
which is really nice and interesting. But before that, I want to ask you, what are the ages that you treat?
Ages and children.
Yes.
Well, let's rephrase the question. When do you take your child to a pediatric dentist? With the
Okay.
first tooth. If your child started having, like, if you have a one tooth, you have to go to a dentist because we don't only treat children. We help parents, teach parents how to take care of their teeth. We just give them a plan, a lifetime plan, how to take care of their children's teeth, how to clean, how to control their diet. So mostly the first visit, not for the child, for the parents. So with the first tooth, you visit the dentist. And then once they lose all of their baby teeth, it depends. Like for me, sometimes I see a 10-year-old with like one baby tooth, but the rest are permanent teeth, adult's teeth. But still, the child is not comfortable. I mean, not child, he's a grown-up, خلاص. Once he's a grown-up and I feel like he's ready to move to go to the adult dentist, I just refer. And some of them, they just stick on staying with me till they're 14, 15. And then I'm like, you're a grown-up. I can't handle this.
No more.
You're too grown
So
for me.
you like, is it really this different that you can't handle them?
Behavior. No, it's not. Yeah, I mean, I can, but am I comfortable doing it? No, I stick to tiny sizes. I stick to 4 or 5 years old. I mean, I do see sometimes family and friends, but I'm not as comfortable as treating children.
Okay, but it's the
It's
same
doable.
treatment.
It's doable.
It's
yeah.
doable.
Yeah.
Oh, okay, interesting. Okay, special needs, because
Yeah.
they are really interesting. And what ages, first and foremost, do you treat when it comes to special needs? And is it that different?
Okay, so when you say special needs, their community, it's not directed by age. When you say special need, it's خلاص, it's a special need no matter how old, because their need, they're part of the special part in them that you cannot control them. You cannot convince them. You just have to do what you have to do. So pediatric dentistry, part of our job is putting patients under general anesthesia, where we put them asleep and we fix all of their teeth, because some children will not cooperate. So we do the same with special needs. We cannot control them. They have something genetic or like hereditary or whatever symptom, whatever thing they have. We just put them asleep, fix their teeth all in one session. We do this in all ages. And sometimes we ask other specialty to join us in the OR so they can do their part, I do my part. So that's what makes us different, that we do treat under general anesthesia.
Okay, but a question, why don't you just do the same with kids and just skip the biting part?
One bite better than taking the child to general anesthesia every 6 or like 7 months. Because you have to go to the dentist whether you have a cavity or not. You have to visit the dentist every 6 months. If you pass your childhood without getting cavities, it's really hard to get a cavity when you're grown up. So it's really important to just keep on going to the dentist, whether you have pain or cavity or not. So general anesthesia is not a solution. It's not like the first solution, it's the last.
Okay.
So
So
it's on the menu.
Okay, great. Well, ladies and gentlemen, it's time to take our second break right now, and we'll be back after it talking more with Dr. Fatima here, so stay tuned.
You and I on UFM. You and I. You and I. UFM.
Hello again, ladies and gentlemen, and welcome back to your show, You and I. And welcome back as well, Dr. Fatma. Thank you for being here.
Thank you.
It's such
Thanks
a
for
pleasure
having
to see you, actually. Okay, tell me, nowadays, some people nowadays with this quarantine, some are actually, I know it's not quarantine anymore, but some people are still afraid to go to the hospital. Some people are still afraid to go outside their houses, whether it's a hospital or no. So my question is, how do parents deal with their kids in these type of situations if they, let's say, have not that of a pain, but let's say some small bites, let's
Okay.
call it. Yeah.
So, Minister of Health, to start with, they gave us directions on how to deal with in such pandemic timing. Don't go to the dentist unless you have an emergency. What is emergency? The emergency is when your child is in so much pain that they can't sleep.
Okay.
Okay, make sure your child does not have any fever or whatever signs we have. Other than this, you can stay home. So, controlling your child's diet can help a lot in maintaining the child's health. We're all chilling and staying home together with families, so we tend to have a lot of sweets and like cake. And
also, actually.
we need to know what kind of diet we should focus on, what kind of diet we should avoid, what are the habits. So I always ask them to okay, don't forget brushing, but it's not going to work if you brush and you keep on having sugar all day. Let's have our sugar one time a day instead of having let's say one bar of chocolate. Having a bite every 2 hours is going to harm my teeth more than having the whole bar at once.
Okay.
Just have it one time and then just wash or brush your teeth. We need to focus on diet more than just only brushing.
It's hard, especially with kids, because some kids are sneaky. They know where the chocolates and
I get
candies
this
are.
all the time from parents, and I tell them, when I was a child, I know where is the box of chocolate.
That's the
we
problem.
always know. So just don't. Let's not have chocolate. Let's buy chocolate for today, and let's finish it today, and then wait until next time, which is in 2 or 3 days. Let's change it with fruits, something healthy, and then if they look for chocolate, they will not find it. That's how you're going to stop it.
So
but
it's-
having it and hiding it does not work because kids are
Parenting
smart.
problem. Yeah.
Kids are way smarter than what you think.
Yeah,
so
true.
Let's not treat them as they're stupid. They're not stupid at all.
Yeah, true.
Yeah.
Strangely, they are smart. You face these situations and you're like, wow.
Yeah,
and I like those reactions.
When other than pediatric dentists, let's say general dentists, treat kids, they treat them as their kids. And the child know when you're treating them like they're children, and they act like children. Talk to them like they're grown up, and they're going to surprise you of how bad they can take things. And they answer the way they answer. They copy adults, but they really understand everything and know how things go.
Nice. Smart. Okay, regarding brushing their teeth.
Yeah.
A lot of kids nowadays, let's say in big families, they have older brothers and sisters. And usually when it comes to brushing their teeth, they're all using the same toothpaste.
Yes.
My question is there let's say toothpaste specialized for those who are, let's say, under 15 and toothbrushes as well?
Okay. So again, every product we have goes under the Saudi Food and Drug, the SFDA. So we have rules and regulations for everything. The amount of fluoride in the toothpaste is the thing that control it all. So it's 1,500 ppm for adults.
Okay.
And for children is 500. So it's, let's say, 30%. So for children, why less for children? Less for children because they might swallow it by mistake. So yes, and plus they have a lot of drawings on it, and that taste better than only mint. So and for children 1-year-old child, you can have a toothpaste with a little amount or even without fluoride in case they swallow it, because you know how kids sometimes they just end up swallowing the whole toothpaste. So in order to avoid such situations, you just put a tiny piece of just as big as a rice.
Okay.
Yes, piece of rice.
That's tinier than I
That's
expected.
tiny. But with time, you have to train the child to spit the whatever toothpaste they have instead of them swallowing it. Because if you swallow big amounts of it, you're going to have toxicity.
So is it better that I brush his teeth before treating him how to brush his own teeth?
Of course. So you have to help a child to brush his teeth until he's 8.
Okay.
8 is the time where the child's development is full, mental-wise and physical-wise, where they can brush right and left the same way, because the way they control the right is better than the way they control the left. So it has a way of doing things and like their development. So better just to keep on at least watching them and check after they brush, check their teeth, because they think if they brush the front teeth, they're done.
Yeah,
And
the
actually they're
whole
not.
thing is done.
Yeah,
True.
and they're sneaky.
Yes, they are, which I like about them. That's
Smart.
nice. Yeah.
Smart, yeah.
Smart. Okay, when can they start brushing their teeth?
If you have a tooth,
The first one?
if you have a tooth, it should. I mean, this tooth, poor little tooth, need to be brushed.
Okay.
Because some children they're only 1.5 years or maybe 2 years, and they have cavities. They only drink milk, and parents are like, they only drink milk. How come? You know that milk can cause cavities as well. If they sleep and they have the bottle in their mouths, and then they sleep with a tiny amount of milk inside their mouth, they wake up with a lot of bacteria and stuff inside their mouth that will cause cavities. And then we end up just putting them under general anesthesia, and they're barely 2 years old to treat their teeth. And if you have a cavity when you're 2, imagine how is it going to be when you're 10 or 15. So yeah, taking care
that's
from
a
the first
problem.
tooth.
Okay. Taking care of the first tooth, as you said, when it comes to brushes, is there any like special softnesses, sizes, whatever?
But they have like small rubber brushes that you can put on your finger, and you just brush the tiny tooth. Or sometimes we tell the parents to use gauze. Just put the gauze around your finger and wipe the tooth. That will be more than enough, because they only drink milk. It's not like they have 10 teeth or more. So it's only 1 or 2 teeth. You can just brush it, like rub it, and rub the tongue as well, because the tongue can carry a lot of milk.
Oh yeah.
Yeah.
True. Okay, that is for the first teeth.
Yeah.
How about if they add a full set of teeth?
I mean,
Same
brushing,
thing?
flossing, everything. They should drink water, a lot of water during the day.
Okay.
That's a must.
Do they use the same brushes as we adults use?
So, us as adults, we should use soft brushes. You don't use medium or hard unless you have like a special condition. But for adults, when you have a regular condition, you just use soft. The size, I always encourage people to use small brushes, small size, so you can just put it all the way to the right and left, and you reach those tiny areas at the back. Because some children be like, oh, I'm a grown-up, I want a grown-up's toothbrush, and they end up having a huge one that cannot reach all of their teeth. So small brushes, soft brushes all the way.
You see, this is a problem. I am sure a lot of people here don't know that there are soft and hard brushes,
Soft,
which is
medium,
a problem.
and hard.
There's a medium as well. So yeah. So guys, please take care. Like when you're going to buy a toothbrush, just read. It's all about reading, right? So-
Ask.
or ask.
Google.
Yes, true. Okay. Let's go back to special needs. I want you to give me a story. But this time, give me like the best story you had or the best situation you faced with them.
I mean, special needs are really special. It melts my heart
They truly are.
because they can do nothing. They can do nothing about it, and you can do nothing. So you just treat them. And I mean, generally, special needs and children, I treat all the same. They're pure. You know, when they like you, they like you. When they don't like you, they will not lie. They will just bash it in your face. They'll be like, we don't like you. I mean, for me, special needs, they're just humans. It's the same with everyone. Generally with children, it's that pure session where they can feel your intentions. So just don't hide things, don't sugarcoat things, just be smooth and just be clear about everything.
Just like it is. Okay, we have a call from Abdullah. Let's see what his question is. Hello, Abdullah.
Assalamu alaikum.
Wa alaikum assalam.
I just would like to ask the doctor if you don't mind.
Yes, sure, go ahead. She's
Tafadhal.
listening.
Doctor, I think this is the best way to instruct the kids. It's to brush our teeth in front of them, so they will be ideal guide to them. So
Perfect.
once they say their parents are brushing their teeth in front of them, they will know that it's something very important.
That's what I always tell the
This-
parents, exactly. Brush your
And,
teeth so they can see you brushing.
And my question, how often that we should change our toothbrush? How regularly? Every 2 months,
3
3
months.
we should change it?
3 months.
3 months.
Usually
Okay,
we do
appreciate
3
it.
months.
I appreciate it. Thank you very much.
You're welcome. So, yes, I always ask the parents to brush. So, we have this age, 2 years old. We call them copycats. The child is a copycat where if you walk, he will walk right back, right at your back. He will copy your movement, the way you act, the way you talk. If you brush and they see you brushing, they will think that, okay, this is a thing that I have to do. But imagine if the child didn't see anyone brushing. And then one day you'll be like, oh, yalla, come, let's brush. They'll be like, no, I don't want to. Just toothpaste's yucky and whatever. So you have to brush. Make it a thing that the whole family does all at once. Mother, father, children, or you as like a parent, just brush with them. They will find it really cool because if you don't do it, it's not going to be cool for them. So you have to just make it as a habit. And for the toothbrushes, yes, sometimes some of us go really hard on the toothbrushes and the bristles break. You find your toothbrush just looks ugly. You don't know why. Maybe because you're too harsh on it. Just take it easy. Do not overbrush because sometimes overbrushing can harm your teeth as well. So 3 months usually we get rid of the toothbrush and get a new one.
But I notice some people, they're like brushing so hard because they're not sure if the actual brushes are reaching a certain point in their mouth or between their teeth.
So let's differentiate between brushing hard and reaching places.
Okay.
Brushing hard, it's like when you have anything, when you rub anything for so long, it's gonna wear off. You don't want your teeth to wear off. You want to brush the right way. The technique should be used right. You need to as well massage your gums because your gums can carry a lot of bacteria as well. Reaching places, again, you can reach those areas by using a small brush. Other than that, between teeth cannot be reached by toothbrush. Never. 35% from your teeth surfaces cannot be reached by toothbrush. So if you don't floss, congratulations, you're going to get cavities. You have to use a floss.
Okay, so let's not say there's no point of brushing,
No,
but
of course.
you have to combine the
Again,
two together.
35% cannot be reached. So you're brushing the rest of the 35%. But flossing is really important as well.
Can we do it as well for kids?
Of course. If you have a contact between your teeth, then you need to brush. You need to use a floss. But children usually they don't have contacts between their teeth. Usually they have spacing. If they have a spacing, it's really easy for us to just clean. But once they have contacts, they should floss. Yeah.
Okay. How about this question just popped into my mind regarding bracelets?
Braces.
Braces, sorry. Yeah. When can we start putting braces on children?
Okay, a brace is a very general term because you have a braces and you have a lot of devices that can be used that people call braces. When they see a metal part in your mouth, they'll be like, oh, this is braces. So we have a lot of devices. Some devices can be used for children when they're starting from 7 years. And then the others go up until they're like 20 or even more. So you're asking about the regular braces. It
Yes.
can be used after we lose all of the baby teeth and have permanent ones, full permanent ones. Then we can fix the final result. Because if you use braces when the child having like mixed dentition, then later on he will shed and he will have new teeth and then it's going to change. So you just wait until they lose all of their baby teeth, probably when they're 13 or 14.
Probably.
Yeah.
Okay, you said there are different types of braces as
Yes.
well. Can you please clarify? Because I'm sure a lot of people, they don't know that there are different types.
Yeah.
Usually they just go to a doctor and be like...
Ask for braces.
Yeah.
So some children, they have deformities. Like they need to they have a narrow jaw. That needs to be fixed. The right time to fix starting from 8 years old because that's the peak in their growth. It can be redirected. We can put like a device to widening their jaws so we can prevent them from having braces later on. If you fix the problem from this age, later on when they grow up, they will not need braces. So we have a lot of devices to fix different problems. With widening their jaws. Some of them, they have something called cross bite, where the upper teeth go like all the way back to the front, to the lower teeth. So we push things and fix it from young age so we can avoid having braces for 2 or 3 years. So yeah, fixing it from young age is much better.
It's really a problem.
Yeah.
It is. I can imagine your work. Interesting, and probably, depending on the situation you're having with the kid, could be a little bit maybe
It's
annoying.
a triangle. Dentist, child, and parents. we need the cooperation of the three of us. If you have uncooperative parent, that's even harder than having uncooperative child.
Oh,
Yeah.
okay. Well, we'll talk more about this after our last break, ladies and gentlemen, so stay tuned.
You and I on UFM. You and I.
تويتر
كل جديد وحصري
@UFM راديو.
You and I. UFM.
Welcome back, ladies and gentlemen. Hello again to the last quarter of the hour of your favorite show, You and I. Back to you, Dr. Fatma, regarding everything about kids, regarding everything. I'm sure you're enjoying this, and at the same time, maybe not.
Yeah.
Depending on the
It's so much fun. I mean,
situation.
why did I choose pediatric dentistry in the first place? It's never the same. You never know what's going to happen. Each 30 minutes is different. When, like, 30 minutes up, 30 minutes down, screaming, fun, crying, hugging, kissing. I mean, the kids are kids. They're so much fun.
You love them in general.
I mean, yeah.
Okay.
I bear them. I can stand whatever they do.
Would there be a chance for you to switch
Switch.
to adults?
No.
Why
Sorry.
not?
They're kids are so much fun. Adults are not. No.
But teeth is teeth?
No.
Not at all.
Little teeth are different than huge teeth. I mean, I really find it really different when I all of a sudden treat a family or friend. I really find it really huge. I'm like, no, pass. I'll just go back to my kids.
Okay. Speaking about that, how often do your families and friends are like, I'll bring my kid to you? I'm sure this is like a lot, but some people maybe get annoyed by that. Some people, maybe they're like, oh.
It's fun. It's so much fun, especially if because they trust you at first place.
That's why.
But
True.
the problem is that this child knows who you are as a cousin or as a family. They will not respect you, and they will do whatever they want to do. You cannot do your magic. So if my cousin, like, yes, my cousin is my patient since she was 4, she will never respect me. I will ask her to sit. She was like, no. I'm like, why? She's like, not today. I'm like, just why? She's just going to have fun today and leave. I mean, but if it was a stranger, they will respect the dentist because at the end, the dentist is a stranger. So we always ask the dentists, like we teach in the university, we ask our students to not treat family because it's going to be hard to treat them, hard on us as dentists, and hard on them to treat you the same way as they treat other dentists. So it's a little tricky.
Okay. So usually relatives, they're like,
The worst
you better
patients
go
ever."
to a friend.
Yes.
Better go to a friend, not me.
Yes.
Okay. One important question
Yeah.
regarding smell, breath smell.
Yeah.
For kids, is the brushing their teeth, is it enough to get rid of it, or like is there any other alternative?
Let's start with why is there a smell? Because sometimes the smell is because of a problem, because of sometimes oral hygiene, and sometimes they have like other problems other than teeth. So, or the kind of food they eat, because some like children, they have, like, let's say abscess or like any swellings in their mouth, then it will cause smell. Solve the problem first. Know what's the problem and then solve it. If it's only brushing, then brushing will solve it. But usually there is more than oral hygiene only to have a smell. Yeah.
Okay. And how do we fix it?
We find
What's the alternatives?
we find out what's the problem. Because sometimes maybe it's not the dentist who can solve this problem. Sometimes the pediatric doctor, the physician.
Okay.
Because they have a problem in their diet or like in their stomach or whatever that cause the smell.
Okay.
It's not only your mouth.
That goes to a different level.
Yes.
Okay, Dr. Fatma, during the break, we talked about parents, and you said that sometimes parents are even harder to handle than the kids themselves. So just tell them something. Tell them something. Tell them how to, let's say, calm down when you come to us.
we have something called separation anxiety. That sometimes when we separate the child from the parents, that the child will get anxiety. But again, sometimes we use it in order to make the child better on the chair. Because when we separate the parents and the child acts better because of the parents. They're afraid because of whatever trauma they've been through with the dentist years ago, they pass it to their children. So if I'm going to examine the child all of a sudden is like happy and okay with it, and the parent will start jumping and asking me to just not overdo things and so they pass their fears. So just when you go to a dentist, choose your dentist properly, trust the dentist, and do not interfere because children get distracted easily. I always ask the parents, when I talk to the child, let's try to not talk all at once because they will just lose it and they will just feel disconnected and just leave the place. So controlling the parents sometimes harder because at the end, it's their child, not yours. They feel that they can control everything. So that's the hardest part.
So true.
Yeah.
Okay, we have another call from Muhammad. Hello, Muhammad.
Yes, hi, how are you?
We're good. How about you?
Fine, thanks. First of all, I would like to thank you for this program. And
You're very
I would
welcome.
like to thank Dr. Fatma
You're
for
welcome.
nice information.
Thank you.
I have two questions. The first one regarding the electric toothbrush. Is it okay to use it with the kids? And the second thing, I think the wash, like Listerine or
Mouthwash.
something like that. That's it. Is it possible to use it for the kids 5 years, 6 years, or no?
Okay.
And thank you so much.
You are very welcome, Muhammad, and thank you very much for your
You're
questions.
welcome, Mohammed. So electric toothbrushes, some of us think that if you use an electric toothbrush, it's going to clean better. The toothbrush, yes, might help, but you have to know how to brush in first place. You have to brush right, even if you use the electric one, because it's not going to brush itself. You have to use it the right way. You have to know where to brush and how, what kind of force you're going to apply. So yes, it can be used. We have electric toothbrushes for children, but they have to be trained well how to brush. So it's not going to brush by itself. Only if the child knows how to brush and be punctual in brushing, then yes, it's going to help. Not fully depending on the electric brush. And the mouthwashes, yes, we have everything for children and for adults. But we need to be careful because some mouthwashes are kind of therapeutic. It needs to be used for a certain time only. That has a kind of a medicine in it that can be used only for 2 weeks and then it should be stopped. Because after that, it's going to harm you. Just like any medication or antibiotic, it should be used for a certain amount, for a certain time, and then stop it. So just be careful on what kind you use. Ask the pharmacist or whatever you buy your mouthwash. As for young children, I don't think they're going to use the wash properly because sometimes they find it really hard to get rid of all the mouthwash. They will just swallow part of it.
Yeah.
I always ask my patient to use like salt and water at first, unless they have a serious problem that we should go ahead and use mouthwashes as treatment.
Okay. Well, Dr. Fatma, thank you very much.
You're
Unfortunately, we're reaching an ending here. But before we go, I want you to give a message for your students.
My
especially.
students?
Yes, because I'm sure a lot of them are listening right now. So give them something. Tell them something.
Students.
Support them.
I mean, I miss them all, seriously. We've been away since March. Yes, we do give our lectures online, and it's not the same. It's really hard to give lectures to a laptop.
Yeah.
Instead of giving it face to face. I miss them all and just stay strong, and I cannot wait till this pandemic is over, till we go back to normal life.
Yes, hopefully, inshallah,
soon.
everything will be back soon. Thank you very much, Dr.
You're welcome.
Fatma.
Thank you for having me.
You are
actually.
very welcome. You're such an amazing friend and doctor as well. And hopefully when I get married, I'll bring my kids to you.
Inshallah.
Definitely.
Soon.
You're the first I'm sliding to.
Thank you.
No doubt about that. Ladies and gentlemen, thank you very much for your calls and thank you very much for being here with us. If you have any questions as well for Dr. Fatma, you can find her Twitter account at tweeted about it on UFM Radio, or you can also give them your Twitter account in case they have.
المطاوعة.
If you have any questions, just go for her. And if you have any questions for me as well, you can ask me or direct message me on my Twitter at Yasser_host. That's YASSER, because a lot of you guys misspell one S with a double S. Ladies and gentlemen, thank you very much. I wish you guys have a great weekend. And that's it. We'll see you again next week with more guests as well. See you then.
On UFM, You and I, with Yasser العلياني. You and I.